Well, hi. I have a question today. And the question is that a female client visits the clinic with complaint of right calf pain. This is to the LPNs, okay? A female client visits the clinic with complaints of right calf pain, tenderness, and pain, right calf tenderness and pain. It will be most important for the LPN to ask which of the following questions. So a patient comes to you and say, I have tenderness to my right calf and it's painful. It will be most important for you to ask which of the following questions. Most important, underline that word, okay? So the first one is, do you exercise excessively? Oh, so you ask the patient, does the patient exercise excessively? Have you had any fractures in the last year? That's the second question. The third question is, what type of birth control do you use? The next one is, are you under a lot of stress? Listen to these answer options and let me know what you think. Option number 1, do you exercise excessively? Number 2, have you had any fractures in the last year? Number 3, what type of birth control do you use? Number 4, are you under a lot of stress? Please let me know what you think. I'm going to pause the video, have you get your answer for me, and let me know what you think, why you would choose that. Why is that one most important for you to ask a question after the patient give you that complaint? So get your answer for me right now. Okay, so I assume you have gone to get your answers for this question. Now, let's look at this question. The lady just came to you and said, I have tenderness to my left calf and it's painful. But the exam know that something is going on, but they want you to be able to ask a question. They want you to be able to figure out, what do you think you will ask this patient? What will you ask? So what you will do with this question is to remind yourself, what kind of problem do I think will be causing pain to the patient's calf and tenderness? It's a calf. Do I know about any problem that is related to calf pain? Do I know? Have I heard of DVT before? So this is what you are thinking. Could it be a DVT? Could it be a venous problem because it's tender? What are the signs? Tenderness, warmth? Do I think about that? I gave you a clue, but assuming you are sitting on the exam, trying to answer this question, trying to ask this patient the next question that is most important out of the 4 answer options I gave. So the information you need to have understand is that DVT, thrombophlebitis, or clot formation in a vein is usually an inflammatory process, okay? This is how the questions are related to the content. So my first thinking should be that I'm answering the question, okay? But I'm telling you how you put yourself to think through it if it was you alone with this question on the exam, because you wouldn't have the strategies I'm giving you right now. But you should have a baseline understanding that DVT is another reason. We have thrombophlebitis. We have phlebi, inflammation of the vein, and all those thrombotic stuff. So there will be inflammation of the vein. So the risk factors will be varicose veins. Does the patient have varicose veins? Yes, no. And did you see any varicose vein in the answer options? No, they didn't talk about varicose veins. Does the patient have any obstruction? Yes, I would start thinking of some kind of obstruction because it's tender. That means something is not right in there. That I would think. So risk factors for this thrombophlebitis, which will be phlebitis, thrombophlebitis, or DVT, is a group of them. The risk factors will be varicose veins. And I told you the question didn't mention anything about varicose veins, so I'm not worried. It's not that one. Oral contraceptives. They didn't add any of the answer options to be about oral contraceptive use. Did they? Yes, of course. They did ask about birth control, right? So I have the risk factors, oral contraceptive. And then in the question, in the answers, there's one that is telling you to ask the patient if they use any oral contraceptive. And I know contraceptives, oral ones, are risk factors to DVT. So the next one is immobility. As the patient moves a lot. And this one says immobility, not moving. So if you are asking the patient if they are under a lot of stress, what sense would this make? Would this really answer the question? No. It's only when they are not moving too much that they can have that problem. So recent surgery or injury. So looking at the answer options, the one that will address any of these risk factors is the oral contraceptives. That's the birth control. But you cannot go straight and say, do you take oral? The question didn't say, do you take any oral contraceptive? We have different types of birth control. So have you had any fractures in the last 1 year? It is not relevant to the patient complaint right now. If I had fractures last year, what has that got to do with me having pain and tenderness to my leg today? Will that fracture, if I had that fracture, it should have been healed by now, or is in the healing process. Does it look like an infection to you? No, it's tenderness and it's painful. Yes, you can relate it to infection or something going on with my foot. But what has my former fracture last year got to do with this problem I have today? Does it have a link? Could it be that it wasn't healed well? But this is 1 year ago. So look at the time period alone. It tells you that you could ask that, but it's not the most important thing to follow up right now. I had a fracture last year. It's part of my history of fractures. Yes. But it's not really most important now. Do you exercise excessively? And it could cause a sprain or splints. Could cause shin splints. Yes, it can cause shin splints. But listen, the risk factors for DVT is immobility, if you're not moving. So if I am exercising, it doesn't really go that well with me with that one. Okay, so the fourth answer choice, you say, are you under a lot of stress and should be concerned about possibility of DVT? Does stress cause DVT? That's the question you ask. So if you didn't understand that birth control, a form of birth control, can be a risk factor for DVT, how then do you ask, do you use any birth control? So the correct answer is actually the birth control question. Do you use any birth control? But that is after you have understood the risk factors. This is where I push you back to the content. So in the first place, they didn't tell you it was DVT. You have to come up with that diagnosis based on the complaint. Tenderness is on the calf. They didn't say tenderness on the forehead. Okay, so if it's on the forehead, you are now concerned about increased intracranial pressure. You're concerned about the patient's neural function. But this is on the calf. It's an extremity. So what are the problems? Vascular. Remember, under cardiovascular system, I spoke about peripheral vascular diseases. This is where the question is taking you back to. So if the problem is on a peripheral, you start thinking of possible risk factors. If you didn't know this, please go and study. This is all what I'm going to tell you. I'm not going to give you any more questions, but this is just a quick test for you. Have a good day. Okay, goodbye.